Quick note before we get into the episode, there will be no YouTube installment of Ask Dr. Murphy this week in public health next week. There will still be a post on Substack of the most recent headlines and news from Dr. Murphy. If you'd like to see that story, please subscribe to our Substack in the bio. Now let's get into the episode. Good afternoon, and welcome to Ask Dr. Murphy this week in public health. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator with the Havey Institute. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing well, thanks.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines and research through today, May 7th. We welcome you to submit any questions or comments down below or at any of our social media linked in the description. Starting today with big global news, the hantavirus outbreak. Dr. Murphy, can you break it all down for us?
Yeah, so this is an ongoing story. We don't have all the answers. We actually don't know that much about hantavirus because it's pretty rare. There's about 30 cases a year in the United States. Argentina has actually quite a bit. They've had over 100 cases in the past year since last June 2025. And they're a much smaller population than we are, so they've really got, relatively speaking, per capita, they've got a lot of hantavirus. Our hantavirus here in the United States, it's occurred in over half the states, but the bulk of it is from the Four Corners territory. So that's Arizona, New Mexico, Utah, and Colorado. So but it can be anywhere. There's been 3 cases actually reported in Illinois, not recently, starting in 1996. There was a case in Northwest Illinois. Then 2005, there was a case in Kankakee. And then I think the last one was 2012 in Iroquois County. And there was some um, um, history of working in areas where there could have been rodent droppings, which is how this thing is spread, especially in the US cases, which are called sin nombre, no number, that, you know, this is the type that is the more severe type, but it's only been spread animal to human. There's been no human to human transmission. In Argentina and South America, the Andes virus, the Andes are the mountains there, they call it the Andes hantavirus. That has definitely spread human to human. In 2018, there was an outbreak. 29 people got infected, 11 of them died, and they could trace the virus spreading person to person, so without animal involvement or not much. Anyway, so it's that's the virus. So now we have it on a boat, and we know that infections can spread on boats. You get a COVID can spread very quickly. Norovirus, the virus that causes diarrhea, been a big problem on some of these boats. And now we have a boat that started in Argentina, the southern tip of Argentina, and they went all over the South Pacific and Antarctica and everything. And the boat left on the 1st of April. And on the 11th of April, there was a Dutch couple. They got sick, or the husband got sick and died on the boat. So they didn't know what it was. People die on cruises from a variety of reasons. But anyhow, unfortunately, his wife also got ill and was flown to Johannesburg, where she collapsed in the airport, was taken to a hospital, and also died. And the two of them had hantavirus. So we don't know, nobody knows if the other 6 people who've been likely infected, whether they got it from this Dutch couple or whether there's something contaminated on the boat. But as the boat was kind of island hopping in the South Atlantic, people were getting off and flying home, five to the United States, but all over the place. A Swiss person actually did test positive and I think is hospitalized in Zurich. But that's the story. Then when they finally got to Cape Verde, everybody knew what was going on and they wouldn't let them get off the boat. So now the boat is in the Canary Islands, which is part of Spain, and the Spanish have allowed the boat to land, and they've evacuated the remaining sick people. So it's very uncommon, but it's a can be a very lethal disease. The disease in the Western Hemisphere is pretty lethal, 40 to 50% mortality or 30 to 50%. Whereas the European and Asian variety of this thing, it's about 15%. And they tend to get more kidney disease, and the Western Hemisphere ones tend to get more lung disease. So that's where we are. We don't really know too much else. There was a flight attendant who has been tested for hantavirus, but we don't know if they have any symptoms. They had been in contact with one of the patients who flew back to the Netherlands, and but we don't know if that person was sick or we don't know. It just said a flight attendant would get tested. So we'll see. This is a story that's playing out, and very unfortunate story. Very nasty, nasty disease if you get it. So that's kind of where we are right at this particular moment. So what's the risk to the general population? Very low. This thing is not like COVID. COVID killed 1% the people that got infected, but it was very, very easy. Billions of people got COVID and got it multiple times. This is much, much, much harder to get, even when it's human-to-human transmission, like this Andes virus is happening. So that's pretty much the story.
Yeah, that's where we stand. So far, 8 confirmed cases and 3 deaths, sadly. And I understand that the incubation period is kind of long, so we could see more cases
Mhm.
pop up here. Is that correct?
Yeah, it's up to 8 weeks. So the range I've seen is 2 to 8 weeks. But we don't even know, if it could be 1 week. I mean, it's so little really known about this disease. It's been around for hundreds of years. It usually is not diagnosed. There was a study, they were doing a study of dengue virus in, I think, Sri Lanka. This was published not that long ago. And they were, the symptoms all kind of are the same for all these things. They get like flu-like symptoms, abdominal pain, some diarrhea. They get some, generalized malaise and fever. And so they were looking for dengue. They found 5% of those people actually had antibodies to hantavirus. Um, and so we don't know really what that means. There might be a lot of asymptomatic hantavirus that we don't ever pick up. But we just really don't know. There is no vaccine. There is no specific treatment. And there's no funding to do any work in this area because it's so rare. But maybe that will change.
Mhm. Well, we and the rest of the world will continue to have our eyes on this story as it develops. But getting back into our more regularly scheduled programming, excuse me, we do
Mhm.
have some big COVID news this week. First, looking at some of the cardiovascular effects, COVID in combination with heart attack is bad. Can you bring us the data?
Yeah, so we've known that COVID can affect heart disease, and people with heart disease do worse with COVID. That was known from the very beginning. It's one of the high risk groups, people, and with any kind of cardiac disease, they're considered high risk. And we have treatment for COVID. So if you get COVID and you have any kind of heart disease, you should definitely take that treatment. So anyhow, this is um, a registry, North American COVID-19 myocardial infarction registry. They followed 2,300 participants, and the researchers found that the COVID patients who had a severe heart attack had a 25% higher risk of death than the ones that were uninfected. And the 1 year death rates were 25% higher in patients with COVID and more than double the pre-pandemic rate. So it just COVID, heart disease all goes together. Another nice story about why you really don't want to have COVID.
Mhm. And following along, a different study looking more into the mechanisms of what might be causing COVID to affect your heart more. There was a study in the Journal of the American Heart Association just published. Can you break it down for us?
Yeah, very respectable journal. This is from the Pittsburgh School of Medicine, and they found that COVID patients seem to be uh, recovering from patients that seem to be recovering from the COVID all of a sudden would suffer a fatal heart attack or a stroke. And they analyzed the blood samples from 93 hospitalized COVID patients with a range of disease severity and treatment types. And they found that when the virus spreads into the bloodstream, it damages the blood vessel lining and causes a protein called thrombomodulin to break off, and they think that triggers clot formation, and that can cause a heart attack or a stroke. So it's just another bad thing that can happen with COVID.
Absolutely. Another reason to look forward to those new vaccines that are coming out. But another thing that we need to stay vaccinated against is the measles. We had some good news out of South Carolina last week, but there may be more cases. Can you bring us the latest?
Well, another unrelated to the last South Carolina epidemic of measles. There's a new one. They have two confirmed cases, which is a little bit of a distance, 74 miles from the epicenter of the last one. It's probably unrelated completely to the last epidemic. But the first case actually was associated with international travel, and the second was confirmed in a close contact who had been quarantining since April 17th. Vaccine status unknown. So 39 people remain in quarantine, but none are in isolation. They're not sick at this particular point. So it's back in the same state.
More measles all over the country. And of course, the CDC's weekly totals will come out on Friday. So we don't have the updated full number for this
Mhm.
week. But we do have some new news on a Surgeon General nominee. There has been a change. Can you tell us about
Mhm.
it?
So the last nominee, Casey Means, was a Stanford-trained physician who didn't have an active medical license, who left her surgical residency to pursue a wellness advocacy business, basically. Um, Very contentious confirmation hearings, and her candidacy was withdrawn. So she was never going to make it through the Senate confirmation. So, a new one, Dr. Nicole Saphir. She's a radiologist and director of breast imaging at Memorial Sloan Kettering Cancer Center, highly reputable place. And she is generally viewed by medical experts as a more credentialed and scientifically grounded candidate. Um, some physicians have noted that this new candidate has shown willingness to affirm mainstream vaccine science, including the benefits of the HPV vaccine. Though she has also made a couple statements saying that, oh, yes, healthy children have died from the MMR vaccine, a claim that's unsupported by any facts that we're aware of. And she also thought that spreading out the vaccination schedule was probably a good thing. That's not very radical, but I mean, those are minor compared to Casey Means. So we're looking forward to see where this goes and get this position filled. I think she's probably going to be able to make it through the confirmation hearings, and I think it sounds very promising.
Absolutely. Very promising to hear that. And I'd like to thank you, Dr. Murphy, for your time and your expertise breaking down this hantavirus and all the rest of the news for us this week.
Well, that story is going to continue for a little while, so we'll see.
Absolutely. Thank you so much, Dr. Murphy, and thank you all for joining us for Ask Dr. Murphy this week in public health. Any questions or comments are always welcome, and we hope to see you back next week. Have a nice one.
Have a good weekend.